This statistic that changed the way I practice medicine came from a study I read during my third year of residency, and I have never been able to forget it. 62% of all strokes occur between the hours of midnight and 6 in the morning. While the person is asleep, unaware, unable to call for help, unable to recognize what is happening to them, they go to sleep feeling fine. They wake up, if they wake up, with one side of their face drooping, unable to lift an arm, unable to find words that were there the night before, or they do not wake up at all. And in 32 years of clinical practice, the question that has haunted me about that statistic is not just how to prevent it. It is why. Why does the sleeping brain become so vulnerable? Why does the stroke happen in the dark, in the silence, precisely when the body should be at its most protected and restored? Modern medicine largely has answers to parts of that question, but the most complete, the most clinically useful, the most actionable answer I have ever found comes from a medical tradition that has been asking that exact question for over 2,000 years. My name is Dr. Ming Chen. I am a board-certified neurologist and internist with a subspecialty focus in cerebrovascular health and integrative medicine, and I have spent 32 years practicing at the intersection of Western neurology and traditional Chinese medicine. What I want to share with you today is not a rejection of modern stroke science, quite the opposite. What I want to show you is how the ancient clinical framework of Chinese medicine illuminates the biology of nocturnal stroke in ways that Western medicine is only now beginning to articulate in its own language, and how that illumination can give you, starting tonight, a set of practical tools to protect your sleeping brain. Let me give you the conceptual anchor for this entire video. Think of your brain's blood supply the way you might think of an irrigation system in a large orchard. During the day, when the sun is up and the trees are actively photosynthesizing, the water flows steadily, the pressure is maintained, the pumps are running at full capacity. But at night, the system shifts. The pumps slow, the pressure drops, the water moves more sluggishly through the channels. In a well-maintained orchard with clean, wide, unobstructed pipes, this nighttime reduction in flow is perfectly safe. The trees are resting, they need less. But in an orchard where the pipes have narrowed over decades, where deposits have accumulated, where certain channels are partially blocked, the nighttime reduction in pressure becomes the critical vulnerability. Not enough flow to maintain the margin of safety. And somewhere in that network of narrowing pipes, the water stops moving entirely, a stroke. This is precisely what Chinese medicine describes in its own language when it speaks of the nighttime vulnerability of shui, the blood, and its relationship to the liver, the heart, and the kidney systems during the hours of sleep. And this is what modern vascular neurology describes when it documents the nocturnal physiology of blood pressure dipping, heart rate variability, autonomic balance, and platelet aggregation that together create the perfect biological storm for ischemic stroke in the early morning hours. Today, I am going to walk you through 5 things that Chinese medicine has known about sleep-related strokes. 5 insights that are now finding remarkable confirmation in peer-reviewed neuroscience. And I am going to give you, for each one, something concrete and actionable that you can take into your own life. The first insight is this. In Chinese medicine, the liver is the organ that stores and regulates the blood during sleep. This is not a metaphor. Between 11 at night and 3 in the morning, the hours that Chinese medicine assigns to the liver and gallbladder in its circadian organ clock, the blood is understood to return to the liver, be purified, and be redistributed. When the liver qi is stagnant, when the liver blood is deficient, or when liver yang rises unchecked during the night, the smooth, steady return and redistribution of blood to the brain is disrupted. The result, in Chinese medical terms, is windstroke, zhongfeng, a sudden disruption of consciousness, movement, and speech that Chinese physicians have been documenting and treating since the Han Dynasty. Now, here is what modern neuroscience says. The liver, not as an energetic concept but as a physical organ, plays a central and recently rediscovered role in nocturnal coagulation balance. The liver produces the majority of the body's clotting factors and anticoagulant proteins, and their balance shifts measurably during the sleep cycle. A study published in the journal Blood from researchers at Harvard Medical School demonstrated that the activity of plasminogen activator inhibitor 1, a protein that suppresses the body's natural clot dissolving system, peaks in the early morning hours between 4 and 8 a.m. This means that the body's ability to dissolve a newly forming clot is at its absolute lowest, precisely when blood pressure surges accompany the morning cortisol awakening response. The liver, the same organ that Chinese medicine identified as the nighttime governor of blood, is now understood to be producing, in a circadian rhythm, the exact biochemical conditions that make the early morning hours the most dangerous window for thromboembolic stroke. 2,000 years apart, the same observation. What can you do with this knowledge? Chinese medicine's answer for supporting liver blood and preventing liver yang rising during sleep is remarkably specific and evidence adjacent. Adequate sleep between the hours of 11 p.m. and 3 a.m. is not simply a lifestyle preference. It is, in both Chinese medical and modern chronobiological terms, the window during which hepatic clotting factor balance and autonomic cardiovascular regulation are most active. Going to bed after 1 a.m. consistently disrupts both systems simultaneously. The Chinese medical recommendation is also to avoid alcohol in the evening. Alcohol is understood to specifically agitate the liver yang and disrupt the blood storing function during sleep, and modern hepatology fully confirms this. Even moderate alcohol consumption in the evening measurably elevates morning platelet aggregation and disrupts the normal nocturnal dip in blood pressure that protects cerebrovascular health. The second insight from Chinese medicine concerns what it calls phlegm, tan, and its role as the hidden substance that obstructs the channels of the heart and brain. Phlegm in Chinese medicine is not simply mucus. It is a pathological product of impaired digestion and fluid metabolism that accumulates in the blood vessels and the heart system over years, creating a thick, viscous internal environment that predisposes to obstruction. Chinese physicians have described this phlegm pattern as the most common constitutional substrate for stroke in older adults, and they have identified a specific clinical profile for the person at highest risk: overweight, prone to fatigue after eating, tendency toward heavy limbs and clouded thinking, snoring, and a specific quality of the tongue, coding that trained practitioners can detect years before a stroke occurs. Read that clinical profile again. Overweight, post-meal fatigue, heavy limbs, clouded thinking, snoring. This is the metabolic syndrome profile, the same cluster of findings that modern cardiology and neurology have identified as the highest risk phenotype for ischemic stroke. And the snoring is not incidental. Snoring is the audible signature of obstructive sleep apnea, a condition that in adults over 60 affects an estimated 40 to 60% of those with hypertension, and that is now understood to be one of the most powerful and most underdiagnosed independent risk factors for nocturnal stroke. The mechanism is precise. Repeated episodes of airway obstruction during sleep produce cyclical hypoxia, brief drops in blood oxygen that trigger surges in sympathetic nervous system activity, spikes in blood pressure, and platelet activation. A study published in Stroke, the flagship journal of the American Stroke Association, found that patients with moderate to severe obstructive sleep apnea had a 2.5-fold increased risk of ischemic stroke, independent of all other vascular risk factors. And the vast majority of those patients had never been evaluated for sleep apnea. They simply snored. Their partners had learned to sleep with earplugs, and every night their sleeping brains were being subjected to the exact internal environment that Chinese medicine identified millennia ago as the breeding ground for windstroke. If you snore, or if your partner tells you that you stop breathing during sleep, this is your most urgent action item from this entire video. Ask your physician for a sleep study referral. Today, this week, not next month. A sleep study that reveals and treats obstructive sleep apnea can reduce stroke risk by more than 50% in some populations. It is one of the single highest leverage interventions available for nocturnal stroke prevention in older adults, and it costs nothing to ask for. Let me tell you about a patient I will call James. 68 years old, retired electrical engineer from Michigan. He came to me 18 months after his wife had passed away, during which period his sleep had deteriorated significantly. Late nights, alcohol to help him fall asleep, irregular eating, weight gain of about 22 pounds. His primary care physician had noted that his blood pressure, previously well controlled, was now running consistently higher in the morning readings than the evening ones, a pattern called non-dipping, or even reverse dipping, which is a recognized marker of significantly elevated nocturnal cerebrovascular risk. His physician had increased his antihypertensive medication, but no one had asked him what his sleep looked like. When I took a comprehensive history, James described waking 2 to 3 times per night, consistently feeling unrefreshed in the morning, regardless of how many hours he slept, and his adult daughter confirmed that he snored loudly and sometimes went silent for alarming stretches. His sleep study revealed moderate obstructive sleep apnea with an apnea-hypopnea index of 22 events per hour. 6 months after beginning CPAP therapy, combined with elimination of evening alcohol and a dietary protocol targeting what I described to him in Western terms as metabolic inflammation and in Chinese medical terms as phlegm damp obstruction, his morning blood pressure had normalized, his non-dipping pattern had resolved, and he had lost 14 pounds. He has not had a stroke. He does not know that he almost did. I do. I want to pause here, right at the middle of this video, and ask you something personal. Do you know what your blood pressure does at night? Most people only check their blood pressure during the day at the doctor's office or with a home monitor in the morning. But nocturnal blood pressure, in the pressure your vessels are under during the hours of deepest sleep, is increasingly recognized as a more powerful predictor of stroke risk than daytime readings. If you have a home blood pressure monitor, set it to take a reading at 2 or 3 in the morning for a few nights and share those numbers with your physician. The technology exists. The information is invaluable, and almost nobody does it. If this video is giving you information that you have genuinely not heard before and that you believe could protect someone you love, please give it a like right now and subscribe to the Dr. Ming Chen channel if you have not yet done so. Every week I bring you exactly this kind of integration, the best of what modern medicine knows and the best of what the oldest medical traditions have preserved, because neither tradition alone gives you the complete picture. The third insight from Chinese medicine is about a concept called heart-kidney disconnection, a state in which the warming, activating energy of the heart and the cooling, anchoring energy of the kidney fall out of their reciprocal balance, producing a specific pattern of nighttime agitation, heat, palpitations, and disturbed sleep that Chinese medicine identifies as a precursor to internal wind, the pathological internal movement that culminates in stroke. In a younger, healthy person, the heart and kidney communicate fluidly through what Chinese medicine calls the chong, the penetrating vessel, maintaining a dynamic equilibrium between activity and rest, heat and coolness, arousal and restoration. In an older adult under chronic stress with disturbed sleep and years of excessive mental activity and emotional suppression, this communication breaks down. The heart yang floats upward, unanchored. The kidney yin cannot root it. And at night, when the yin is supposed to dominate and bring stillness, the yang agitates instead, producing the palpitations, the night sweats, the half-sleeping anxious state, and the autonomic dysregulation that modern neuroscience would describe as elevated nocturnal sympathetic tone. And modern neuroscience has a great deal to say about elevated nocturnal sympathetic tone and stroke risk. The normal healthy sleep cycle involves a profound and protective suppression of sympathetic nervous system activity, a reduction in cortisol, a drop in blood pressure of 10 to 20%, a slowing and deepening of heart rate variability that gives the cardiovascular system its most important nightly repair window. In adults with chronic psychological stress, insomnia, and what Chinese medicine would recognize as heart-kidney disharmony, this nocturnal sympathetic suppression fails. The blood pressure does not dip. The heart rate variability remains constricted. The vascular endothelium, the delicate inner lining of the blood vessels, is denied its nightly repair signal and accumulates inflammatory damage. A study in the journal Hypertension from researchers at Columbia University's Irving Medical Center found that adults who were classified as non-dippers, those whose blood pressure failed to drop by at least 10% during sleep, had a 63% higher risk of stroke compared to normal dippers after full adjustment for daytime blood pressure levels. 63%. Not from a disease that has been diagnosed, not from a cholesterol level or a blood pressure number that a physician has flagged, simply from what the blood pressure does in the dark while you sleep. What does Chinese medicine offer for heart-kidney communication? The herbal formula, Tian Wang Bu Xin Dan, often translated as the Celestial Emperor's heart tonifying elixir, has been used for this exact pattern for 400 years, and modern pharmacological research has begun to identify its active constituents. Xuanzao Ren, sour jujube seed, contains compounds shown in a study from China's Academy of Traditional Chinese Medicine to reduce sleep onset latency and significantly improve deep sleep architecture through GABA-A receptor modulation. Danshen, Salvia meteoriza, the same botanical I mentioned in a previous video for its cardiovascular effects, also has direct endothelial protective properties that are particularly relevant during sleep. I want to be clear, I am not prescribing these herbs through a YouTube video. Herbal medicine is real medicine and requires proper professional evaluation. What I am sharing is the framework and the growing body of peer-reviewed pharmacological evidence that validates why classical Chinese physicians build these herbs into their stroke prevention protocols. The fourth insight from Chinese medicine is one I find particularly beautiful in its predictive precision, the concept of liver wind. In Chinese medical theory, when the liver yang has been rising unchecked for years, driven by chronic stress, insufficient sleep, excessive alcohol, a hot, greasy diet, and constitutional factors, it eventually transforms into liver wind, a rapid, unpredictable, destabilizing internal movement that can, in an acute event, ascend to the brain and produce the sudden paralysis, speech loss, and loss of consciousness of a wind stroke. The warning signs of nascent liver wind, signs that Chinese physicians have been trained to recognize for centuries, include recurring headaches at the crown or sides of the head, a sensation of pressure or pulsing behind the eyes, episodes of dizziness that come on suddenly with position change, occasional moments of tingling or numbness in the fingers or face that resolve within minutes, and episodes of transient blurring of vision in one eye. Every single one of those symptoms has a direct Western neurological correlate. They are the symptoms of transient ischemic attacks, TIS, the brief self-resolving episodes of cerebrovascular ischemia that modern neurology recognizes as the most powerful short-term predictor of imminent stroke. Studies published in the Lancet Neurology have demonstrated that the risk of a full ischemic stroke within 48 hours of a TIA is as high as 10%, a medical emergency by any standard, though one that is dramatically underappreciated by the general public. If you have experienced any of those symptoms, a sudden brief episode of face or arm numbness, a few minutes of slurred speech, a sudden one-sided visual disturbance, a brief severe headache unlike your usual headaches, and you did not seek emergency evaluation, please talk to your physician immediately. These are not signs of tiredness, they are not signs of stress, they are neurological warning signals that the irrigation system of your brain is under acute threat. And if Chinese medicine had a clinical tradition of calling them the early expression of ascending liver wind, a warning that the storm is building, and if modern neurology calls them TIAs, transient ischemic attacks, they are both describing the same urgent biological reality. The fifth insight is the one that I believe is the most immediately actionable, and the one that ties the Chinese medical tradition most elegantly to the emerging science of chronopharmacology and vascular neurology. Chinese medicine has always emphasized the extraordinary importance of the pre-sleep ritual, what you eat in the last 2 hours before sleep, how you transition from the activity of day to the stillness of night, what emotional and mental state you carry into the sleeping hours. The evening in Chinese medical thought is the time of the kidney and the pericardium, systems that govern the transition from yang activity to yin restoration, from outward engagement to inward repair. Disrupting this transition with late night eating, with stimulating screen activity, with unresolved emotional conflict, with alcohol consumed as a sedative, is understood to directly compromise the quality of the nighttime yin restoration that protects the heart and brain. Modern vascular neuroscience offers the mechanism. Late night eating, particularly of high glycemic foods within 2 hours of sleep, produces a postprandial blood glucose and insulin spike that elevates sympathetic nervous system tone and increases platelet aggregation during the very hours when those processes should be at their lowest. A study from Brigham and Women's Hospital, published in Circulation, found that evening caloric intake above 30% of daily calories was independently associated with impaired nocturnal blood pressure dipping, precisely the pattern we identified as the 63% stroke risk amplifier. Late night screen use through blue light suppression of melatonin and the emotional arousal produced by social media and news delays the onset of the parasympathetic dominance that initiates the protective cardiovascular rest state. And alcohol, which produces an initial sedative effect that many older adults mistake for restorative sleep, actually fragments sleep architecture in the second half of the night, eliminating the deep, slow-wave sleep that is the neurological equivalent of the kidney yin restoration described by Chinese medicine. Here is your action checklist. 7 things you can begin implementing starting tonight. Number 1. Establish a firm sleep window that includes the hours of 11 p.m. to 3 a.m. This is not arbitrary. It is the chronobiological window of peak hepatic clotting factor balance and maximal liver blood restoration in the language of both Chinese medicine and modern vascular biology. Number 2. If you snore, or if anyone has ever told you that you stop breathing during sleep, request a sleep apnea evaluation from your physician this week. This is the single most high leverage intervention for nocturnal stroke prevention available to older adults, and it is profoundly underutilized. Number 3, stop eating at least 2 hours before your target bedtime. If you're hungry in the evening, choose a small amount of warm, cooked food, not cold, not sweet, not heavy. In Chinese medical terms, nourish the yin without burdening the spleen. Number 4, eliminate alcohol within 4 hours of sleep. I understand that for many people, this is a significant lifestyle change. I also understand that the risk it is protecting against is one of the most catastrophic events a human being can experience. The math, in my clinical judgment, is not complicated. Number 5, take your blood pressure at 2 or 3 in the morning on at least 3 separate nights and share those readings with your physician. Nocturnal blood pressure is one of the most important cardiovascular metrics that most people have never measured. Number 6, learn to recognize the warning signs of a TIA, sudden brief face or arm numbness, sudden brief speech difficulty, sudden brief visual disturbance in one eye, sudden severe headache, and treat them as the neurological emergencies they are. Do not wait to see if they resolve. Call emergency services immediately. Number 7, create a pre-sleep decompression ritual of 20 to 30 minutes. Dim lights, warm, not hot, shower or foot bath, gentle stretching or meditation, no screens. This is not wellness theater. It is the deliberate initiation of parasympathetic dominance, the biological state that, sustained through the night, lowers your nocturnal blood pressure, reduces platelet aggregation, and protects your sleeping brain. Please remember that everything shared in this video is general medical education and does not constitute personal medical advice. Do not make any changes to your medications or your medical care without first consulting your own physician, who knows your full clinical history and your individual risk profile. I want to close by saying something that has been on my mind throughout this entire video. The sleeping hours are when your brain is most alone, most vulnerable, most dependent on the silent, invisible work of your cardiovascular system to keep it safe. The fact that 62% of strokes happen during those hours is not random. It is biology. And biology, once understood, can be worked with. You do not have to be passive in the face of that statistic. You do not have to simply hope that tonight will not be the night. The tools exist. Ancient tools confirmed by modern science and modern tools illuminated by ancient wisdom. And they are accessible to you right now. Share this video with someone over 60 who you love. It may be the most important thing you do this week. Give it a like if it gave you something real. And leave me a comment telling me, do you know what your blood pressure does at night? The answer might surprise you. I will see you in the next video.